Or if you get sick, does it take you longer to recover than it should? And if you get sick, does it tend to flare up your symptoms and then it lingers beyond the time you're actually sick? If stress flared you up, you're getting sick frequently, then that shift, make me think, well, maybe there's a good bit of immune system related issues versus, hey, when I'm in a car, man, that's just really rough on me. When I've got to concentrate, I'm at a grocery store, that's really rough. Now that's more neurological based. Now, once again, you can have different ratios. Some people are 50-50, some are 90-10, but it's about what's making you tick. Yes, I know there are people who were diagnosed with it a decade ago. It wasn't really an official diagnosis, okay? So because of that, it's now getting more and more accepted. When we look at POTS, as I've said, most of the people I've experienced with, it's neurological or it's immune system. How would we even evaluate the nervous system? Some people are thinking MRI, CT scans. Well, for POTS, these usually aren't of great value. And most of the time we get nothing from it. It's not a good use of money. So balance, eyes, and brain waves can be critical in seeing how the brain's functioning because this is about clues and pattern recognition. The more off this testing is, the more symptoms it causes, the greater the likelihood when we treat it, you are going to feel better. Versus if you ace it, it doesn't make you feel anything, then that wouldn't be the right approach for you because there is no magic bullet for POTS. There's not one treatment that works for everyone. So having a good workup can help know which path you need to be on. So balance testing. So what does balance testing look like? This is someone who did initial testing and then post-treatment testing. The higher the number, the more movement they had when we performed this test. Now, this was done using a computerized software where they would stand on a platform and recorded how much they moved over a certain time span with eyes open, eyes closed on a firm surface, and then again on a perturbed surface, so a balance pad. And this person moved way more than they thought they would. And guess what? Once we got them treated, they did a lot better. Now, this test alone for POTS and other dysautonomias can be a little bit tricky because you do have fatigue and muscle weakness with POTS. And sometimes people, their balance is really a reflection of that fatigue and being tired and weak. So I don't put all my stock only in balance testing, okay? So whenever I see these patterns, someone's got symptoms of POTS, I strongly start thinking, hey, there's a good degree of neurological issues that when we get this addressed, they should be feeling better. And in my experience, 90% are going to be feeling a lot better as we address that.